Hey everybody, today is part one of a three-part mini-series about what's standing between you and treating your hearing loss.
In this three-part series, we're going to talk about several common barriers that we have identified that may stand between you and treating that hearing loss. And today we're going to specifically talk about stigma and what happens when you underestimate your hearing loss.
Stick around. Hey everybody, I'm Dr. Michael Squires.
And I'm Dr. Carly Squires.
And this is Dr. Squires Squared,
a channel where we have candid and casual conversations about everything audiology.
If you're not sure what audiology is, make sure to hit the like button, subscribe to the channel, get our notifications, and we're going to tell you all about it. All right, today's episode is part one of a three-part mini-series. We're talking about stigma and underestimating the reality of one's hearing loss.
Right, so let's start with stigma. So how many times have you, or I know we've heard it a lot, people say, hearing aids make me look old.
But that's not really the case. What actually makes you look old is not being able to participate in the conversations that people want you to participate in, or worse yet, that people think that you are participating in.
Exactly, yeah. Saying what, asking people to repeat, those types of things tend to make you look much older than actually being a part of that conversation.
Right.
And so hearing aids are really a tool so that it can prevent you from looking as if you're aging.
You know, one of the other parts to the topic of stigma that people often bring up in my appointments are the size of hearing aids. People think that they're, we're going to be fitting a shoe behind their ear or something the size of a banana, when the reality is they're actually much smaller than that. I mean, my hearing aids are very small, but they still have all of the capabilities that are needed to appropriately treat the hearing loss. And in some cases, they come with connectivity options or Bluetooth or all kinds of tech savvy or tech forward options,
right,
that people don't really realize.
So that even can make you look younger as well. You're going to be able to connect to a smartphone and take phone calls through the hearing aids most times. They are rechargeable now. They come in fun colors like the navy blue that Michael has. So really there's a lot of options out there that is completely away from those older style hearing aids that a lot of people are thinking of when they say they make me look older.
Right. Now you're going to spend 25 minutes fixing your hair again.
All right, so let's spend some time talking about underestimating your hearing loss and what happens when you kind of downplay what's actually happening.
A lot of times our patients will come in and kind of when we're talking through kind of what the case history looks like, they'll say, I don't really notice any issues. I'm only here because my husband made me come, or my wife made me come, or my family's noticing things that I don't really experience. So I'm just here to get it checked out to shut them up or whatever the situation might be. But in reality, at the end of the appointment, what we typically find is there's some type of hearing loss there. If others are noticing it, there's probably an issue there. It's kind of the analogy that we talked about in a previous episode about depression with Dr. Stephen Gibbons and Michael Moore. Michael made kind of an analogy about a frog. If you boil a frog, gradually, they don't know that it's even happening. That's the way that hearing loss kind of sets in. And for most people, as the hearing loss over the course of time happens so gradually that the person that is being affected doesn't really notice that it's happening.
Right.
It's everybody around them that's going, there's a problem.
Absolutely.
Get out of the water.
Yes, yeah, and that's what leads to a lot of that denial of just saying, I don't have a problem, it's other people around me. If everyone would stop mumbling, I could hear just fine. But the reality is then the patients are maybe sometimes underestimating what that hearing loss is. Once they know it's there, they say, well, it's not that bad. I'm still functioning just fine. It's not bad enough to treat, right?
Right.
And that leads into a whole nother topic, but
Well, there's just nothing good about minimizing the problems
Right.
that we know are there. If we went to our physicians and they said, well, there's a significant cardiac issue, none of us are going to say, well, it's really nothing that we need to do anything about right now, right? No, we'd be interested in learning what the next step is for treatment. And it should be like that with any medical issue, including hearing loss.
Okay, everybody, we're going to just kind of wrap up what we talked about. A couple of those barriers we face today are the stigma. So stigma of hearing aids, whether they make you look old or they're too big. We kind of busted that a little bit, showing you that they're actually quite small and pretty techy now. And actually, by treating your hearing loss, it makes you look a whole lot younger than where you were before.
That's exactly right. And also, the second thing that we talked about is underestimating or minimizing the issue that we have already discovered is there, whether the patient notices it or not. And the way that we can bust that is there's a whole slew of statistics that are in favor of treating the hearing loss earlier rather than waiting on it. Things like improving or stabilizing the brain's ability to understand speech, or minimizing fall risk, or minimizing the long-term effects of cognitive damage related to untreated hearing loss. So there's so many things that we have talked about in previous episodes, or probably will address in the future, that are in favor of treating the hearing loss. So don't minimize the issue that we've discovered is there. Let's talk about how we can kind of get over some of those barriers so that we can get some appropriate treatment.
Yeah, and if you can think of a concern, like if you know you have a hearing loss, you've been diagnosed with that, and you have a particular concern that's worrying you, just mention that to your provider, and I'm sure that he or she will be able to walk you through that to help guide you in the direction that you should go to treat it and have a much better quality of life.
So if you have any questions for us specifically about this topic or others, please give us a call at 304-428-2403, or shoot us an email at info@hearwv.com. The next episode will tackle part 2 of our 3-part series about getting over some of the things that stand in the way of treating your hearing loss. So until next time,
Thank you.
see you guys.